We'll start. So, hello friends, welcome to our channel. Since the counseling season is on, we are here again with another review. Today, we have residents from Reliance Foundation Hospital, Mumbai. They are in their second year of their radiology residency. I am Sachin Kumar. I am a consultant in Vedanta Hospital, Patna. I am your host today. So, guys, introduce yourself.
So I am Dr. Dev Kansara. As Sir said, I am a second year DNB resident in HN Reliance Hospital, Mumbai.
Hi, I'm Dr. Raveena. I'm also a second year DNB Radiology resident in Reliance.
So, guys, let's begin with our first question. How's the department structure? How many residents are there, and how many faculties are there?
So basically, we have two primaries per year. So total, as of now, we are six
Primaries.
DNB residents, and plus we don't have secondaries right now. We have, I think, this year we are going to apply for that, and plus we have three CAs right now. Otherwise, sometimes there are vacancies also, two more, and right now there we have only
So,
three.
CAs are like senior resident equivalent.
Yeah, the clinical assistants.
Post MD, recent post
Yeah.
MD.
And then consultants, so we have full-time consultants also and visiting. In CTMR, we have basically three main full-time consultants, and Dr. Abhijit is there, and Dr. Himanshu and Dr. Rahul. Otherwise, we have a visiting consultant for all the subspecialties. Dr. Meher is there for neuro, and Dr. Aditya Daftari, and other consultants also, Dr. Nidhi and all. And in USG also we have full time and visiting consultants. So the USG is mostly it's not a divided into subspecialty where like all the consultants do all kind of studies. But in CTMR we have subspecialty differentiation.
So, these part-time consultants, how many hours do they come to hospital? Around.
Yeah, they come for like 5 to 6 hours.
Okay.
That depends. And CTMR mostly they can report from home also,
Home
but
also.
ultrasound people they come for 5 to 6 hours at least.
Okay, and full-time consultants are there for complete
Yeah, from 8 to 8 most of the time. Yeah.
And like between the full-time consultants, part-time consultants, who are like more interested? Like who teaches more?
Nothing like that actually. Even Dr. Lula comes, he comes for 2 hours in the morning.
Yeah.
But he also teaches wherever and whenever he feels that this is important, he also tells us many things.
Okay.
So, and because most of the consultants are part time, like Dr. Sabha Sheikh and Dr. Rajni, so they are also very interested in teaching and academics, and they also usually ask us for PPTs and all, and they teach us from their side also. So
Okay.
that nothing like that.
Okay, and how's your posting routine and schedule like year-wise?
So our at HN it's a little different from other hospitals. Directly from first year we give CT MRI posting and X-ray ultrasound posting. So it's one month each. So
Okay.
either you are in X-ray ultrasound or you are in CT MRI, and next month you will be in the other one. So that's little unique. So for a first year when he comes, they will be put into conventional radiology, and after, so they usually draft x-rays and fluoroscopy procedures they do till around 4:35, and then after that they move on to ultrasound, and then when they go into the next month in CTMRI, we give them exposure to at least, and starting they see scans, protocols, they monitor scans, and then when they start understanding anatomy and stuff, we directly just give them two draft simple plain CTs and all. So that is a little different thing that we do here, that we give early exposure to CT and even MRI, like simple MRI, brain, stroke protocol and all, which is going to be important for their on call. Uh, so we just make them used to the language and how to draft and how to approach basic CTs and MRs.
As a second year, may I ask how many, like in a CT posting, how many CT scans are you drafting every day?
So roughly around 20.
That's a lot. So,
Yeah, because we have four
There's a lot of work.
MRs.
yeah.
So we have
So,
around 40
and
MRs
till
per
what
day.
time are you guys working then to draft those 20 CTs?
So official work time is from 8 to 8.
Eight.
Yeah.
Okay. Yeah, so 12 hours. And as she said, that we have at least 40 MRs per day because we have 4 MR machines.
That's a lot.
Yeah, say 60 CTs. Actually, it's a 350 around bed hospital, but this amount of work is still happening because there's OPD as well. So we draft, as she said, around 20 CTs and at least maybe 7 8 MRs at least.
And how's the how many consultants are there, like subspecialty wise? Like I think in neuroradiology, Dr. Meher is there.
In neuro, there is Dr. Meher and Dr. Inder Talwar. He's from
Okay.
Bombay Hospital. Dr. Meher, she doesn't need any
Yeah,
introduction.
she's very
Yeah.
famous.
So yeah, she's there since a long time. So these are there for neuro radiology specifically for that. But even Dr. Rahul Bakaria, previously working in Wockhardt, he is also doing quite a lot of neuro.
Hmm.
And then for MSK, we have Dr. Himanshu and we have
Dr.
Dr.
Aditya
Aditya Daftari. He's a
Aditya
part-time.
Daftari, he's
He's a
part-time.
part-time. But he comes to the hospital for procedures, and then you can interact with him and learn from him, especially the procedures, MSK related
He is
procedures.
also someone who doesn't need any introduction. He's a
Yeah,
legend.
yeah. So
Yeah,
he's famous all around Mumbai.
yeah.
So that is for MSK. For chest, we have Dr. Parang, who's previously working in Jankaria.
Hmm. Oh, Dr.
And
Parang Sangvi is there.
yeah.
Yeah,
Dr.
yeah,
Parang
yeah.
Sanghvi is there, and also Dr. Himanshu. So they
Okay.
both handle chest and cardiac mainly. And Dr. Abhijit also does some of cardiac. He's like he does everything.
Yeah.
So yeah.
So for
So
the
that
viewers,
yeah.
Dr. Abhijit Rawat transferred from Kokila to HN. And
Yes.
that
Now
was a great
he's
loss for Kokila and a big gain for HN.
correct.
Yeah, yeah,
He's
yeah.
he's now HOD. So since 4 5 months he's here and he's changing the department and making it in his style. So yeah, academics and
I
all.
can totally guess that. Abhijit sir by far is my favorite teacher in my entire
Yeah,
radiology
he's
career.
become our favorite also.
Yeah.
He must be teaching you guys a lot.
Yeah.
So he's like really boosted the whole academic thing here, and he started neuro radio meets and neuro hepat
Hepat
meets.
meets and
Sorry,
all.
radio hepat meets and all.
Okay.
And since he's from KEM and from KDH, so all the academics, he's very interested. More, in fact, I feel he's more interested in academics than his own reporting.
That is
So
actually good for residents. That's really good.
he's
And
taking all the initiatives.
that's good. And okay, so seems like department is hectic. So like in this backdrop, is it easier to get leaves there, or do you guys don't get it?
So basically, one person can get a leave one time, so not all of us together. So the DNB allotted 30 leaves per year. So there's usually no issues regarding the leaves. Only just you have to adjust between your among yourself.
Okay, okay.
Otherwise, no
Well, in
issue.
advance, if you just put an email and you just tell them, and if there's no one else who's on leave on the same days, then it's fine.
Fair enough, fair enough. Okay, are you guys exposed to intervention radiology? Do you guys get posting in intervention?
Not a dedicated posting, but the CT biopsy and ultrasound biopsy they happen in the department only. So we do get to assist in all the procedures like that. But like hepatic intervention or neuro intervention or vascular, we don't get a dedicated posting for that.
Although we have a dedicated IR department, and they are talking that we'll give you in third year some maybe 1 month, 2 months, but still in talks.
Yeah, but okay, do you guys do like independent FNACs? Are you guys doing? Because
No, under observations.
that was one thing. That was one thing that was even
Once we've
lacking in.
assisted in a certain number of FNACs, yeah,
You
certainly,
can do right.
Yes,
Because
yes.
see, the thing is that in government colleges, the residents do FNACs left, right, and center. That's why I'm asking. Even in
Yeah,
Kokila, that was lacking. That's why I'm asking.
obviously, since it's a DNB institute, not left, right, and center, but yeah, if you assist and if that consultant is
So if you're
confident,
interested, you show your skill, you'll get it.
yeah, certainly. Even
That's
biopsies
good.
for that.
That's good.
Yeah.
That's fair enough.
Yeah.
Yeah. Okay. And how's the PAX situation in the department?
So we have packs from GE.
Okay.
So it's pretty good packs. We can put a keyword and search any kind of reports.
That's great.
And yeah, so MR, if you want to study something and all, you can just put a keyword and you can get that all the reports of that diagnosis basically. And initially we used to have some other packs, but recently they have changed. But we have access to the previous packs also by the IT department if you want to.
And keyword searching, I believe, is really good for residents to learn.
Yeah,
Like
Yeah,
as a
yeah.
junior resident, if you want to read your seniors' reports,
correct.
okay, let's just see that how a certain thing is drafted, and let me learn the language. Then it is really good. So I
Yeah,
think that
yeah.
is a
Single
great
most
thing.
helpful thing that has helped us because
Yeah.
we learned much from the reports also.
Yeah,
Yeah.
because theory knowledge is different thing, and learning the language of radiology is a very different thing. That
Right.
comes practically.
And we have saved formats also, like a
Hmm.
normal formats also in the pack system. So it's good.
So yeah.
Then that's good. That's good. And okay, can you tell like how many CTs, how many MRIs, how many ultrasounds happen generally in a day?
So as
So,
I said,
yeah.
there are like around 40 MRs a day.
40 MRs.
Yeah, and 60 CTs at least a day.
That's
And
good number.
ultrasounds are more than 100. And what else? Fluoroscopy procedures. Sometimes we have, sometimes like at least two or three a day.
Yeah.
Maybe more than that. Maybe 5 or 10 also depends. And what else? Procedures. Yeah.
Procedures,
So Dr.
biopsies.
Sabha ma'am, she is very like she's very famous for procedures. So she is mainly for procedures. So she comes and she has like lined up at least 4 or 5 procedures at least per day. And if you count ascitic tapping to then a lot of procedures. But
Okay.
the actual good USG guided procedures, Sabha ma'am does 4 5 in the morning. Then in the evening, some other consultant might have one or two lined up. And CT guided also at least in a 1 week, at least 2 or 3 at least.
That's good. That's good. Okay,
Yeah.
tell me one thing, like very specifically. If you
Mm.
guys are posted in ultrasound, then
Mm.
do you guys do the preliminary scan first and then the consultant
That's
checks?
how it is.
Yes,
They
yes, yes.
consultants ask us to do it first,
Hmm.
take all the images, and then they do it. And
Then
then
you show your findings to consultant?
Yes,
yeah,
yes.
yeah,
They
yeah,
review
yeah.
all
They
the
in
review all the
fact before
scans.
they start the scan, they'll look at our images and they'll see what all we've taken, and they'll ask us what do you feel,
Yeah, so
and
for the viewers, that is a really good thing. Yeah,
yeah.
Yeah, we
that's
get
how
a
it should
constant
happen.
feedback on everything.
Okay.
Even for CTMR,
CTMR is the same.
whatever we draft, even if it's like a small error, the consultant will call us up and they'll say, "See, you've done this error." Like even for basic mistakes, sometimes it happens, but still we're caught with that because it undergoes like they see it very well, and even small mistakes are caught.
Okay, and how's the exposure in obstetrics ultrasound?
So obs on call mostly you get a full hands on, but during the daytime the obs ultrasounds are relatively lesser in number. But still, if you request a consultant, they'll let you do first the obs ultrasound, otherwise, and then you will review it.
So it's not like there's zero ops, but it's not like the bread and butter here. There are only the OPD patients who have come with an appointment. They come in the morning, and usually there's a lot of rush. So like if a resident wants to learn,
Mm-hmm.
there'll not be so much time to learn. But when you're doing op scans in the emergency and all, when once you get a hand to it, then the consultants will themselves call you. Okay, this is an anomaly. Come, we will do it together. So you will get exposure. It's not zero, but it's not like you will do like 50 op scans every day. That's not gonna happen.
That's okay. Anyway, 3 years of residency, I always tell my juniors, 3 years of
Yeah.
residency is never enough to learn everything.
Correct.
Yes,
Correct.
yes.
Correct.
It's never enough. कहीं
But
से भी
rest
कर लो,
in
do it from AIMS Delhi, do it from Harvard. 3 years is not enough.
correct. Correct.
Yeah,
Yeah.
true.
You're right.
And okay, how's the academics programs there? Teaching schedule and seminars and everything. How's it happening?
So once every week we have a PAT meet.
Okay.
Okay, then neuro meets are usually 1 in 2 weeks. Okay, then regular seminars will happen the weekly. I mean, Dr. Abhishek has recently came to HN and he has structured a good academic program. So we have all to follow it, and basically we have to present most of the cases. So
Presenting is really important.
yes, yes, yes.
Presenting, and then obviously he will add on whatever he feels is
Yeah.
lacking on that.
Presenting cases is what makes you prepare for DNB finals.
Yeah,
So
yeah,
it
that's what he
depends.
stresses on.
It depends on residents also how much you are interested to learn. They will just request you, okay, present a case, and it's on you whether you prepare a PPT, and so that's really upon us. If you want to learn,
True,
and you
true,
can
true.
just say I will present. So yeah. but it's good. It's getting better day by day.
Yeah.
That's good. That's really great to hear. Okay, and how's the accommodation situation? I hear that you guys have like 3-star hotels, like accommodation.
Yeah.
Yeah, so basically the accommodation is like 150 meters away from the hospital.
Okay.
So it's very near to the hospital. You don't have to travel like in Kokilaban. I've been there.
Yeah,
Travel
Kokilavan
like for
accommodation
I
was not
think
in a good place.
yeah. But this is a pretty good area. But it's not a dedicated hostel. So basically it's a residential complex and Reliance has few apartments in it. Okay. But the cleaning and everything is done by the
It's
housekeeping. You
like
don't
a
have to
serviced
do.
apartment sort of situation.
Yeah, it's kind of like that. Okay. And so bed sheets and everything is done by them.
Wow.
Okay. You don't have to do anything.
And you have AC.
Yeah, AC. It's
I don't think
Oh,
you at a hostel in
that is
Mumbai.
like way better than how it was in Kokilavan.
I've seen their hostel. So it's much better than that. The only thing is, there is no mess. You have to order your food and cook by
Plus, I
yourself.
think the hospital and the hostel itself is in Sobo, South
Yes,
Bombay.
yes. You can. In the hospital, you can have your meals and everything.
So yeah,
Yeah.
at a subsidy, the hospital provides meals for doctors.
How many
That's
is it? How much is it? The meal?
I think
80, like
for
80.
a for
for
like
a
a
meal.
thali kind
Yeah.
of thing, and it's good quality food, like hot and good quality food. You can eat it every day, so I don't think that should be an issue.
Yeah. But we have to share rooms. So basically, it's either a twin sharing or a triple sharing. It depends on your luck, which one you'll get.
Also,
But
yeah, one more thing I forgot to ask. Night duties. How hectic are the night duties? How many do you guys get
So
per week?
night duties are hectic. And not like in so many hospitals, people have alternate night duties, but they're not so hectic. But here, we have night duties 4 to 5 times a month.
A month.
So that's not so much frequency. And we have also post call off. So after like midday, next day you can go.
Post call office.
Yeah,
Plus.
because the post call off is there because night duties are hectic. And usually there's only one senior, so he's handling both CT, ultrasound, MR, everything. And junior will be there, but in the first year we can't obviously put them on night, so we put them with us, but they are just like observers. But the main thing has to be handled by one person. It's not like there's one for CTMR and there's one for ultrasound because they're
So,
giving post call off, so they can't afford to give two
okay,
residents.
help me understand. So, like if you are posted in a night duty, you are with a clinical associate?
No.
No.
So
You're not?
so I'll tell you. So first year residents for the first 6 months will, or 6-7 months, whenever they feel comfortable, will be as observers.
Okay.
And second year on, and even late first year on, once you're
Independent.
comfortable, you're independent. So even that's a little different, maybe.
Yeah,
But
that's different
we've
because in
actually- yeah,
Kokilaben,
we've actually
it was always
done-
in pairs, secondary, primary, or clinical
No,
assistant
it's
primary.
Because
not
we
like
don't
that.
have secondaries
It's not like
and we
so
have very few CAs, so
the
only
only
primary.
accompanying person, if there may be sometimes, because every day there's someone has to do a night and every day the juniors won't be doing night, so sometimes you're on your own and sometimes if there's a junior he's just an observer.
So, okay,
basically
tell me
there's
one
only
thing,
one
like,
person.
what happens if you get stuck in a case at around 3
Just
a.m.?
call the
Yeah, we
consultant,
just obviously we call and we just
confirm
ask
with
for
them, that's it.
Oh, that's good. So,
That's fine.
consultants are a call away, right?
Yeah.
Sometimes they come also on
Yeah,
the,
suppose
for
if it's
ultrasound.
suppose if it's a challenging case, like if they think there's ectopic or something, then they'll
They'll come.
They'll come.
Yeah.
Then
Even
that's
for
great. That's great. That's great.
abortions or some, like if there's a abortion, then they have to declare that they'll come.
Okay.
Yeah, for any mostly medical legal.
Yeah, medical
ultrasounds
legal
and-
stuff especially. They
Okay.
come also.
So, guys, tell me one thing. What are the cons of the department? Like, what do you think is lacking?
So I think the workload is very much.
Yeah, for 2 residents every year, the workload is a lot.
Yeah, so that is a major issue. Otherwise, exposure is very good, but the only thing is, because of the very less residents, I think the workload is not equally divided.
Yeah, and that's
It gets very hectic at sometimes.
Yeah.
Even during the day, plus you have to do a night, then sometimes it's very
because
hectic.
night also you're alone.
Yeah, and sometimes you don't even get to sleep for
Okay.
a second. Yeah.
So,
that-
okay, I'll tell you one thing, like, very honestly. Way back in 2019, fresh out of Jipmar, I had come to Bombay. And I interviewed at both HN and Kokilaben. And in HN, that the situation there was different. The team of consultants was different,
Yeah.
and I interviewed in HN. I got through, and I was waiting for my Kokilabin result. And then I won't name him, but a certain resident told that, sir, don't come here. The department is, he used the word toxic. And then
Yeah, okay.
yeah, and I got through Kokilabin. I knew that Kokilabin was a better program. I just went to do my SRship there. So in that context, do you feel that the department is toxic today in 2024?
That was when, sir?
2019.
Yeah, so maybe that time it was toxic, but right now we don't feel that it's toxic.
Because the team of consultants changed.
Has
Yeah.
changed.
As Raveena said, the work is there everywhere.
Work is there everywhere. At
Yeah.
any good
Other than
place,
the
work is
work,
there.
there is
Yeah.
no toxicity.
Okay.
Other than the work, there is no unnecessary.
Yeah, so right now, other than work, there is no toxicity.
Yeah.
Because
That-
initially the consultants were different, everything was different, but now the whole scenario has changed.
All the consultants want is that you do their work and then they don't even care to trouble you.
Okay.
So,
Okay.
I don't think anyone who is coming should worry about toxicity as such.
Yeah.
Okay. And also, yeah, for our viewers, what were your ranks in NEET PG?
So we had NEET 2022. We came in NEET PG 2022. My rank was 1724, and your
I
rank?
think mine was 1900, yeah.
1900. And your juniors have joined HNAT?
My juniors have joined now. They have increased the rank
Yeah.
to 700
And 1200.
and 1200.
Wow.
Yeah.
And
So,
I think after
My-
this
yeah,
interview,
no,
you
no.
might get like top 500 people this year or maybe.
No, I don't know. Yeah, it's very variable. So anyone who is between, I can say maybe 1900 and 500, they can come.
Yeah, depends on which round you're getting.
No,
So-
the same has happened with Kokilabin. Like now, like it's getting
It's
to a
getting,
top.
I think, yeah, maybe at my time, someone with 500 rank would have got Kokila, but this time,
No.
the rank came to HN and she's like, maybe I'll not get Kokila. So, God knows.
But yeah, from what I'm talking, from what I'm hearing from you guys, I think HN is a great program.
Yeah, the only thing is it's not so well known. Like when I was taking HN, I saw your videos and I'm like, where's HN? Where's HN? But there was no video. So because it's a new program, it started only 6 years, I think. Not many people know, and maybe because of the rumors of toxicity and maybe real toxicity at that time, people didn't come. But things have changed now. Things are improving with Dr. Abhijit here with the academics and all at his helm. And it's getting more and more in terms of rank also. So and there is no big disadvantage that I can see.
Yeah.
There's everything that any other DNB institute has and more.
And I think it's better than all the peripheral MD colleges.
Yeah,
certainly.
I believe
Even
that.
I left MD in my
Most
state,
people who come to me, like who are then the counseling, they are like at this rank, mera 1200 rank hai, and so. What should I do? Should I take an MD or should I take a DNB? And this is a big question that everyone has.
No,
but
at that rank you should take DNB at a good place.
Yeah. Because in radio, DNB and all matters because private institute have good machines and that's all very important for radio. Because if suppose you go in a periphery MD and the CT or MRI is not working for suppose 6 months, you will lose out on big time.
Yeah.
So
Happens.
in that sense, if something stops working here, it will be fixed the same day. So that's a difference.
In a lot of peripheral colleges, the consultants are more interested in opening their own centers and running around money rather than teaching the students. And I have seen it
Give as a
happen.
report, it will go as a report in periphery MD. They will not check.
No one is good. No one in a lot of peripheral colleges, nobody cross checks JRs का reports and JRs will come out overconfident है हमने तो सब report कर दिया.
हमने सब So here till third year the consultants are going to, because it's a private hospital, it's a HN Reliance big hospital, so they have to check. They can't just
because their own name is there in the report now. They can't let it.
Even if they don't teach you, for example, you can just look back to the report and remember what you had written and what they had written.
Exactly.
Big learning there, even if no one tells you anything. Then you can obviously ask doubt कि sir आपने ऐसा क्यों लिखा ऐसा क्यों लिखा.
Always check your reports in retrospect. That's the best way to learn, in my opinion. Even I learned that way.
Is I think biggest thing about HN basically.
I feel
constant feedback is good.
That's the biggest thing about any good place. Like whatever big good places are there for radiology residency, reports getting cross-checked, getting feedbacks are the main pillars of radiology education.
Somehow the people in HN, all of them in ultrasound as well as CTMR, they do give feedback. Right now, the people who are there, all of them, they call you even if you've done a scan and you've gone out to have tea or something. They'll call you and be like, I've done the scan. You come back and the patient will wait, and you just do it again and see what you've made a mistake.
Yeah,
That's-
even the night call ultrasounds are reviewed.
Yeah, obviously, yeah. Night,
Yeah,
Okay,
yeah.
guys. Then I think we have done a very comprehensive review of Reliance HN,
Yeah.
and I guess this helps our viewers and to make
Yeah.
better decision. So okay, so the bottom line is, if you are getting HN, you should take
Like
it.
they can put it in the comments, and then you can ask us, and we can.
Yeah.
Yeah.
Put all the queries in the comments, Dr. Kansari and Dr.
Raveena.
Raveena, sorry, are going to answer it. Okay. Okay, guys, chalo. Thanks for the taking time out for the interview.
No issues.
Yeah.
And
Thank you for having us.
So
sir.
finally, there's a
Yeah.
video for HN.
yes, finally, there's a video for HN.
Probably.
And guys, please subscribe to our channel, like this video. That way, our video reaches a lot more people like you who need help. Okay. Chalo,
Yeah.
guys. Bye bye. Thank you. Thank you for watching it.
Thank
Bye.
you.
Thank you.